Welcome to Breathe California TV. Each week we bring you a show on lung health, where Breathe California is the lung health organization for California. Today we're going to be talking with Kelly Ho about inhalers. There's a whole variety of different respiratory diseases. If you want to know more about them, go to Breathe California's website at lungsrus.org or drop into their office where they have 13 different brochures as well as experts, some almost as good as Kelly, to be on the show. But with 40% of kids in some school districts here in San Jose needing inhalers, this will be real good information for anybody that's having some difficulties breathing. So see you in 30 seconds after this public service announcement.
My name is Rene Montez. I've been using the CPAP machine, I would guess 10 years. I got so accustomed to it, I don't go anywhere without it. I take it with me everywhere. From the moment I put it on, I thought it was the greatest thing because the breathing was a lot easier, and after using it for a couple nights, I felt a lot of energy. Breathe California is fabulous.
Welcome back. My name's Terry Trumbull. We've been doing this show for 30 years. My particular perspective is I dislike the major focus of the medical field on treating disease. I try to get a show that's more involved with prevention. And I think Kelly Ho, I mentioned before, who's a respiratory therapist for El Camino Hospital, will help you with a lot of questions you might have on inhaler options, what they're good for, and how to use them. Kelly, welcome.
Thank you. Thank you for having me.
Any rebuttal on what I said about you?
No, that was great. That was a great introduction. Thank you so much.
Okay. So to start off with, what is a respiratory therapist?
Great question. So respiratory therapists, a lot of people confuse as with nurses, so very different. We, inpatient-wise, we work in the emergency department, the intensive care unit, and out on the floors, helping not just breathing treatments. We manage the ventilators, help to put a breathing tube in if the patients need it, whether it's in emergency or for any type of procedures, managing the ventilators, removing the breathing tube. We're part of the emergency response team. We go to code blue emergency situations, help with CPR, help the patients breathe. Outpatient wise, we help with doing spirometry tests, pulmonary function tests. We do a lot of education on how to manage different type of lung conditions, whether it's inhaler medications, whether it is to reduce the airway mucus, airway clearance techniques. And then here, I am at El Camino Hospital Pulmonary Rehabilitation. So my role here, again, is largely on education regarding their lung conditions management, and they exercise here as well. So we monitor them, make sure they're exercising safely, and to help them progress.
So what is the difference between a ventilator, which you mentioned a couple of times, and they've become quite famous with the COVID epidemic, and inhalers? They sound like they might supposed to be the same thing, but they must not be.
Yeah, so ventilator is a machine that will 99% of the time is connected to a breathing tube where we insert through the throat. The machine will have different type of settings to help you breathe when you have trouble, very difficult trouble with breathing. Inhaler, on the other hand, they are medication. So like this kind of inhalers, these type of inhalers. So these are medications that you take maybe every day or depending on your conditions to manage your lung conditions.
So a ventilator is not medicine, meaning it's not providing you with any type of curative substance, as opposed to ventilator is just to help you breathe better?
Ventilator's main purpose is to help you breathe. Whether it is because you are in an accident, you cannot breathe, it will help you breathe, or you need to go to get a procedure, a heart procedure, for example, they put you to sleep and you'll be connected to the ventilator to help you breathe. Sometimes though, we can put medication through the ventilator to give you medicine through the breathing tube to you. But the main idea of a ventilator is to help you breathe when you cannot, when your lungs are either too sick, or to help basically is lung machines if used for your lungs.
So why is ventilator such a big deal in the COVID epidemic? There's certainly been many news stories, at least last year, on shortage of ventilators.
Yeah, so ventilators are a critical support device. So when let's say before COVID, in a hospital setting, when we have trauma situations where, let's say we have a car accident where we need 10 ventilators because 10 people are severely injured, all of them cannot breathe. We need 10 ventilators immediately, otherwise they'll die. So that's a critical device. Now with COVID, because so many people now require, if the situations are critical, require ventilators. So they are taking these ventilators away from other people who may be in an accident, who may be requiring a ventilator, away from them. So when we don't have a ventilator, but we need one because the patient cannot breathe, then it's not a good situation. People can die from it.
So it sounds like ventilators are largely kept in hospitals and in treatment facilities, as opposed to, I have sleep apnea and I have a CPAP machine. I don't even know what the initials are, but it's to push more air into me than I get in normal breathing at night. Any comments you want to make on all of that?
Correct. So CPAP, let's see if I remember, continuous positive airway pressure device. So help you, like you said, give you positive pressure to help keep your airways open so you can sleep without snoring, so you can sleep better. Those are not critical devices. You can still, you won't die if you don't have the CPAP to sleep during the night. Ventilator is required if you need it, you need it. We cannot wait. Your life depends on it. So
back to the original topic that we started in on inhalers. There are about 13 different forms of lung disease. Are inhalers useful for all of them, or is it selective? I guess explain what an inhaler is, although you did get a start earlier, and then whether they work for all forms of lung disease.
Yeah, so that's a great question. We have so many lung conditions. A lot of people associate inhalers with, just lung. If you have a lung trouble, you take your inhaler. But no, not for every single conditions. If you have, for example, interstitial lung disease, where you have scarring or fibrosis of your in your lung tissue, inhaler is not going to do anything. But for a lot of lung conditions, inhalers are a big part of treatment management. So mainly COPD, asthma, cystic fibrosis, for example, inhalers are pretty much their main number one treatment and management strategy.
So I gather it's not uncommon for some school kids to get them and take them to school with them.
Yes, yes, you're right. And therefore, it is important for school nurses or school teachers to actually get educated on how to use at least the emergency inhalers to help the children at school when they need to use them.
And just to put in a plug for controlling our air pollution emissions, a lot of these lung conditions are a product of air pollution, which is 85% from cars. And of course, we've had serious wildfire problems as well. But going back more towards the beginning, I gather there are different types of inhalers that handle different types of symptoms from problems.
Yeah, so inhaler-wise, we have so many different types. Mainly, we categorize them into two, bronchodilators and corticosteroids or anti-inflammatory. So bronchodilators, as the name entails, they dilate the bronchi, so they open up your airways. Whereas corticosteroid or anti-inflammatory, they are to prevent airway inflammation, so then to prevent the swelling of your airway and to reduce mucus production. So they're quite different, and the frequency of using them are not the same.
So talk a little bit about, I only know steroids from professional sports. And so my dentist asked me if I'd ever had steroid medicine before, and I was pretty doggone resistant, like I was going to grow an extra head or something. Are they pretty standardized and work just fine?
Yeah, okay. So a lot of the times people say, oh, steroids, I don't want to take steroids. Now, steroid inhalers and the steroids that are used for muscle building for muscle builders are different type of steroids. Steroid inhalers are corticosteroids versus steroids for muscle building are anabolic steroids. So they're completely different, and they have different effects on our bodies. Corticosteroids are to prevent inflammation of our body, of our airways in this case. So they're quite different.
So we're roughly halfway through at this point, maybe a little bit earlier for our break, but let's take one now and then we'll come back about more information that you and the audience ought to know about inhalers. So we'll be back in 30 seconds.
What it feels like to have an asthma attack is, well, you can't breathe and you can't tell anybody that you're having an asthma attack because you can hardly talk. You can maybe say one or two words, but you can't say much else. Breathe California has helped me come in contact with more asthmatics and more people who have the same case as I do. It's important to me because I don't feel like I'm alone in the fight against asthma.
Welcome back. I'm Terry Trumbull, and this is Breathe California TV. Breathe California is the lung health organization for the state of California. I'm a volunteer, and if you'd like to help us out, just give us a call or check out the website at lungsrs.org. Phone number is 408-998-5865 in the Willow Glen area of San Jose. They've got offices there, and we've averaged serving about 100,000 people in Santa Clara County for the 30 years this show has been on. So welcome, Kelly. What haven't we talked about inhalers that we ought to know?
Yeah, okay. So we were before the break, we were talking about steroids. So I want to add, sometimes patients ask, oh, inhale steroids, what about side effects? So yes, steroids inhalers and any other inhaled medications, just like any medications, they have side effects. Okay, so you should be aware of that. However, when comparing inhaled steroids versus oral steroids, inhaled steroids medications have significantly lower amount of side effects than oral steroids. When your physician prescribes these medications to you, they should evaluate the risks and benefits before they prescribe these medications. And you should ask about them if you are ever curious. And I want to talk about a little bit about bronchodilators. So we said bronchodilators are to open up the airways. Now there are two different types of bronchodilators. There's short-acting and long-acting bronchodilators. Short-acting bronchodilators, their onset of actions are really quick, within minutes. So we call them rescue or emergency inhalers as well. On the other hand, long-acting bronchodilators, their onset of action are much longer. So they take 30 minutes, maybe an hour or two to kick in. Now, the duration of action are different as well. Short-acting bronchodilators, examples such as albuterol or Atrovent, they kick in really quickly, but their effect lasts only maybe 1, 2, 3, 4 hours. Long-acting bronchodilators such as Spiriva, Ceravent, even though it takes a longer time for them to kick in, their duration of action is much longer, 12 hours, sometimes 24 hours. So you need to, if you have a bronchodilator inhalers with you, you need to know whether they're short-acting or long-acting because they're different. Use your short-acting inhalers only when you have symptoms, only when you feel short of breath, wheezing, coughing, etc. Always stuffiness when you have any type of trouble breathing. Yes.
I mean, they sound like it's more of an emergency. We need a solution right away.
Correct.
For your use.
Yes, therefore, we sometimes call them emergency or rescue inhalers, and we always recommend people to keep them with you wherever you go because you just never know when you might need it. Long-acting bronchodilators would be something that you will take every day to maintain your airways nice and open. So we call them control or maintenance inhaler. Another type of control maintenance inhaler would be the corticosteroids that we talked about earlier. So same thing, those you will need to take every day, regardless of how you feel. Even if you feel completely fine, you don't have any trouble breathing, you should still take them to keep your airways from getting inflammation.
So tell me a little bit about care and handling inhalers. Obviously, they don't last perpetually. So do you need to come back and get them refilled because they are dispensing medicine? So what's it like to use one and keep it up?
Yeah, absolutely. So I always instruct my patients, every time you take your inhalers, before you actually put it in your mouth and take it, check the dose counter. It should tell you how many left remaining in your inhaler. Some inhalers don't come with a dose counter, then you have to figure out some way to remember how much you still have left. Now, of course, when you're running low, you go to the pharmacy, get it refilled. But it is very important, if you are taking your inhaler and it's actually empty, then you're not getting any medications. Sometimes people make a mistake, especially when they have the meter dose inhaler. Some people make a mistake of they shake it, they hear something in it, and then they assume that's their medications in it, which is not always true because in this canister itself, we have medications and we have chemicals called propellant to turn the medications into mist for us to breathe in. So what you're hearing when you shake it, what you're hearing might be medication and propellant, or it might just be the propellant without any medications. So always check the dose counter before you take your medication, and get your medication, go to the pharmacy, get it refilled before it runs out, especially with your emergency inhaler, because you always want to have it with you handy.
So one of the things that I try to get in on our shows regularly is my brother was working on a PhD in pharmacology, which is the development of medicines. And he surprised me when he was in school, which was a week or two ago, when he said that every medicine has side effects. And I gather what you're talking about here is it's important to know what the side effects are and be prepared for them, and be making a judgment with your doctor on whether that medicine is a good one for you.
Right, correct. The most common side effects with our rescue inhaler, or albuterol, most people call them albuterol, is palpitation, or you can feel your heart racing, you can feel your heart pounding. Some people get nervous and shaky tremors. With Atrovent, which is another very common short-acting bronchodilator, some people get dry eyes, dry mouth, urinary retention. And then most importantly, with corticosteroids or anti-inflammatory inhalers, the very common side effect is thrush, which is a yeast infection in the mouth. So if you have that, you will see some white patches, almost like cottage cheese, on the tongue, around the lips and around the gum area, and it can be painful. So therefore, every time after you take a corticosteroid inhaler, make sure you rinse your mouth with water, gargle really well, and spit it out. This can significantly reduce the chance of getting a thrush infection in the mouth.
So I would think it'd be pretty easy for a patient to freak out by seeing white patches in their mouth. And so hopefully they'll know that that's a risk, and they follow your suggestions about the rinse after the use. Because that to me just sounds absolutely like something that would freak me out.
Yes, and it can be painful as well, so it's not pleasant.
So tell me, all of the inhalers are prescription? You don't just buy them over the counter?
Correct. These are all prescription and medications. Like I said, like most other medications, they have side effects. So we do need doctors to evaluate the appropriateness for you, whether the benefits outweigh the risks, and get that prescription for you to use at home. It is not something that you can just feel like, oh, I feel like sometimes I feel a little bit wheezy. Maybe I'll go get an albuterol and try that. So no, you need a provider, a medical doctor to prescribe that for you.
Are there limits? You were talking about knowing how much you have in the way of doses. Is it pretty strongly pushed by doctors and medical people that you only want to take one dose at a time?
Yeah, so as far as inhaler medications, there is a gold guideline, they call that gold guideline, to evaluate how much the dosage and how much and how often you should be taking your both bronchodilators and corticosteroids. So for example, when your provider meets with you, they will ask you how many times have you experienced certain symptoms, how many times over the past year have you had to visit the emergency room or get hospitalized. And then from there, they would see, okay, you're in category A or B or C or D, for example. And if you're a category A, they would say, okay, you should take bronchodilators only as needed, for example. Or if you're at a higher category, they would say you need to take bronchodilator as well as corticosteroids every day. And then the next year or so, maybe when you have your follow-up appointment, they ask you the same questions again to see where you're at. And then from there, they will adjust your dosage and frequency of the medications.
So I take a couple of medicines for blood pressure, and the pharmacy is very aggressive about not letting me get pills early. They know exactly how much they gave me for how many days. Is that likely to happen with an inhaler?
I am not exactly sure the answer to that, but I want to bring up you brought up a good point, is that with any type of long-term, long-acting bronchodilators and corticosteroid medications, the maintenance inhaler medications where you should take every day, depending on the specific one you're taking, they either last 12 hours or 24 hours. So in that sense, you should be taking it at the same time every day. So for example, you take it in 7 a.m. in the morning, and that when you take once a day, then you should take approximately the same time the next day. So then you're actually getting the full effects of the medication.
So our final question before we go to a summary is, how do you distinguish between use of a quick-acting inhaler and going to the emergency room?
Oh, that's a good one. Now, if you have COPD or asthma, or even other lung conditions, you might have given a COPD or asthma action plan where you have a green, yellow, and red column. The green one will say, okay, do you have any type of symptoms? You feel good, here's what you should do. Now, what I'm trying to bring with that is that you should understand yourself. Everyone is different. If you feel like today you feel a little bit of trouble breathing, you take your inhalers, it still doesn't go away or it's getting worse, then you should think about, okay, maybe I should call the doctor. Or if you're at that point where you feel like you can't even talk, then it is not the time for you to keep trying. Then it is the time for you to get help.
So Kelly, we've got about 15 seconds. Do you have a quick couple of sentence summary you want to give us?
Yeah, I think it's very importantly, know the inhalers that you're taking, whether it's bronchodilators, long-acting or short-acting, or whether it is a corticosteroids. Know how to use it correctly. If you forget what it is for, if you forget how to use it, go back to your doctor, go back to the pharmacist, make sure you know how to use them. Otherwise, you're not getting the medications in your lungs. So that's very important.
We've been talking with Kelly Ho, a respiratory therapist at El Camino Hospital. We thank you very much. And I can't imagine anybody that watched this show didn't learn a lot. Thanks again.
Thank you so much.
Come join us again next week.